Hi, my name is Sierra Vivens, and this past year at my high school, I was an athletic trainer for baseball. We learned about primary and secondary assessments in our sports medicine class. The primary assessment is the evaluation of the athlete's body for life-threatening injuries. And after you treat these life-threatening injuries, then you can move on to your secondary assessment. The secondary assessment is the history, the palpation, the observation, and the special testing of the athlete's body. The history is just the questioning of what happened and checking their vital signs. Let's say our athlete broke his arm. You need to ask things like what happened, what position was your arm in at the time of the injury, what did you feel, what did you hear, what's the intensity of your pain, have you had any injuries in this region of your arm before. Then you need to move on to their vital signs, which is their heart rate. Their heart rate is how many times they have a heartbeat in 1 minute. You need to find a pulse, which is probably the best place to be in their neck or in their wrist. You need to check count how many times their heart beats per minute. An average teenager should have 60 to 80 beats per minute, and an increase in heart rate could be due to hyperventilation, anxiety, and the increase in activity. They need to move on to their breathing rate. Their breathing rate is how many times their breath rises and falls in a minute. The increase in breathing rate could be due to hyperventilation, anxiety, the increase in activity, medication, and a decrease in the heart rate or breathing rate could be due to a head injury, a lung injury, medication, or shock. An average teenager should have 12 to 20 breaths per minute. Then you need to move on to their blood pressure. Their blood pressure should be around 120 over 60. And an increase in blood pressure could be due to hyperventilation, head injury, anxiety, medicine. And then a decrease could be due to shock or heart failure or a hemorrhage. Then you should move on to their body temperature. Their body temperature should be around 98.6. And if it's not, if it's an increase, it could be due to infection or a heat stroke. And then if it's a decrease, it's probably due to shock. And we'll go over shock later. Then you move on to their pupils. If your pupils should constrict in the daylight and dilate in the dark. Well, if a athlete's eyes are constricting in the dark, it's probably due because they're heavily medicated or they are poisoned. If they are dilating in the daylight, it's probably due to heat stroke or poisoning. If their pupils are unequal, it's due to a head injury, and this is really important because you need to get them to the hospital. Then you need to move on to their capillary refill. Capillary refill is checking to see if their blood flow is coming to their fingers and their toes. You need to check and press on their nail bed, and if their colors should turn back red in a second or two, and if it doesn't, then that means blood flow is not coming to their fingers or their toes. Then we should go on to skin color. Skin color, if it is like a cherry red, is due to heat stroke or carbon monoxide poisoning. If it is blue skin, it's due to the lack of oxygen, and if you have yellow skin, it's due to liver damage. And then if you are pale and you have no color in your lips or in your nail beds, you're probably going into shock. Then you want to move on to the ability to move. The ability to move is called paralysis. And if your athlete can only move one half of their body, they're probably hemiplegic. If he can only move the top half of his body but not his legs, he's paraplegic. And if he can only move his torso but not his arms and his legs, he's quadriplegic. You always need to keep in mind that the pain of an athlete is not always this. You don't need to determine that for the severity of the injury, because a lot of athletes will exaggerate, and some athletes won't even tell you that they're hurt because they want to keep playing in the game. That's all the history. Now you want to move on to observation. You want to check the surroundings of the where it happened at to see if you can find any clues to why it happened. Then you need to check to see how the athlete holds theirself. Because say an athlete is complaining that he thinks he's hurt his shoulder, but if he keeps his arm down by his side, he's really probably not hurt his shoulder. But if he puts his arm up like this and he's holding it like this, he's taking the weight off of this shoulder, so he probably has hurt his shoulder. Then you need to look also for, you need to bilaterally compare. You need to, if this shoulder's swollen, if this one's not, you need to look for swelling, you need to look for the temperature increase, you need to look for discoloration or deformity in it. Then you want to move on to palpation. The palpation is the feeling of your deep tissue to get deeper than just the top layer of skin. For palpation, you need to tell the athlete to relax, and you need to tell them it's probably going to hurt and then what you're going to do. You need to feel for depressions or crepitus, which is bone-to-bone grinding. You need to feel for temperature and swelling and deformities and that kind of thing. After you've done palpation, you need to go on to special testing. Special testing is the range of motion. The range of motion is how well they can move on their own and how well they can move. Shock is whenever your athlete is not getting adequate blood supply and oxygen supply to their vital organs. Some of the symptoms and signs for shock are nausea, thirst, anxiety, dizziness, and then some of the signs are unconsciousness, the decrease in blood pressure, weak pulse, blue skin or pale skin. And then to treat shock, you need to treat the original injury. The original injury is not going to kill the athlete. Your shock is going to kill the athlete. So you need to treat your original injury first. You need to keep the athlete warm, and you need to make sure that you're not feeding them anything or letting them drink anything, because if they vomit, then that can make it worse. You also need to elevate their arms and legs if they're not broken. If one of their arms is broke, you need to not elevate that one. You need to elevate the other three. To figure out if somebody has a break in their arm, you need to check their capillary refill. You need to find a pulse in that extremity, and you also need to you need to check for sensation. And if none of those work, the athlete can't feel one of those, you need to call the hospital ASAP. Thank you for your time.